There's a growing outcry in Hong Kong over hamsters. The government's decision to cull 2,000 of the rodents due to COVID-19 concerns has been met with a backlash. Animal welfare groups are urging people not to panic or abandon their pets. Thousands of people are also volunteering to adopt any unwanted hamsters. Deborah Wong reports.
Scenes like these shocked the city on Tuesday as officials shut down dozens of pet shops in Hong Kong. Health authorities announced that same day that 2,000 hamsters from 34 pet shops and a warehouse will be culled. Thousands of owners have since surrendered their pet hamsters as the mass cull order sparked public outcry.
但我覺得仲有其他方法可以處理嘅，咁先隔離佢哋啦，跟住再研究多啲睇下啲倉鼠係咪真係會傳染人啦。因為聽佢講話倉鼠傳人或者人傳倉鼠呢啲都係聽講嘅，咁驚你一定會驚嘅，所以咪根據專業人士咁講咯，去檢驗，跟住如果有事咪醫治咯，就唔係話一刀切咯。咁人有時會唔會一刀切咧？
Animal welfare group SPCA has received queries from concerned owners. It urges owners to maintain strict personal hygiene and not to kiss or cough near pets, as well as washing their hands after handling them. But the backlash has led to an online petition calling for the government to stop the order. It suggested that instead of culling them, these pets could be quarantined and isolated. The petition has garnered over 25,000 signatures in less than a day. Part of the anger stems from a lack of scientific evidence that an animal-to-human transmission did take place.
And this is really, really different to the situation at home where people have pets. And we need to remember that millions of people around the world have been infected by SARS-CoV-2. Millions of people around the world have pets. And there have been no cases proven of pets transmitting infection to other humans. The same theoretical risk is there, but it just doesn't happen.
Hong Kong's Health Secretary Sophia Chan defended the move as part of precautionary measures, another nod to the city's unyielding zero-COVID strategy as it races to contain its latest outbreak. Deborah Wong, CNA, Hong Kong.
For more, we're joined by Dr. Bharat Pankhania. He's a senior clinical lecturer from the College of Medicine and Health at the University of Exeter. Dr. Pankhania, is the mass culling of hamsters and other small animals over these fears of spreading COVID-19 an overreaction, or is it a reasonable approach, especially in light of Hong Kong's COVID elimination strategy?
Well, I'm reflecting on what had to be done in Denmark with its mink population. So there, the humans infected the minks, and then the minks in return also infected the humans, albeit in a controlled small numbers. The concerns are that this can become endemic in the animal population. And if it does, then it can lead to sporadic outbreaks and persistence of infection. So it's a measured biosecurity measure to remove a source of infection that could lead to it becoming endemic in wild animals.
Well, Dr. Pankhania, if animal reservoirs of infection are the concern, what would count as a reasonable, targeted public health policy to address or preempt this kind of zoonotic transmission?
Yeah, so what we really want to do is make sure, especially with pets and farmed animals, that they are not introduced to this infection, and then also make sure that they do not in turn infect other wild animals. And therefore, a lot of work is required to make sure that there isn't this creation of a reservoir of infections in the wild animals. If that happens, it will become very, very difficult to control SARS-CoV-2 in humans.
Dr. Pankhania, many might ask, though, where we draw the line with the culling of animals as a COVID mitigation strategy, particularly in light of the fact that, as experts have said, it may be just a theoretical risk that, animals who have COVID will pass it on in great numbers to humans.
Yes, it is a small risk, but there is a lot that we don't know about. And there is a lot more work to be done. And in the meantime, the issue is what to do. And therefore, as a precautionary measure, sometimes, like the culling of the mink in Denmark, had to be undertaken. And similarly, remember, hamsters don't live for a very long time. But if it is shown that it can carry the virus, it may transmit it to other rodents. And if it does transmit to other rodents, we might never be able to control it. So it is a measured thing. It is proportionate. And of course, people who keep these pets will be upset. But we've got to take precautions.
Of course, we are moving towards living with COVID, not perhaps Hong Kong, but here certainly, as something that we live with, something persistent infection. In this case, how should we be managing things like possible transmission between species as we move towards living with COVID-19?
Yes, so what we want to do is invest a lot more money in, is there transmission from humans to animals to wild animals? There is a lot that we just do not know. So with regard to wherever there are domesticated farmed animals, we need to enhance our biosecurity measures, introduce measures such as all people who are handling animals must be immunized so that their viral shedding is limited and therefore they don't infect the animals. And then the last bit that we need to do is test and survey and check again with both domesticated animals as well as wild animals, because there is a lot we just don't know.
In some countries, Dr. Pankhania, the United States as an example, they've begun vaccinating some of their animals in zoos as an example. It's not the same vaccine as the one that we use for humans, but should we begin to consider the vaccination of animals against COVID-19 if this risk is as important or significant as you say?
Well, I noted that, yes, the United States has started to do protection measures against primates and other large cats who got infected by their minders and people visiting the zoos, etc. The trouble is, it is very, very difficult to vaccinate the wild animal population. At the moment, there is no evidence that wild animals carry SARS-CoV-2. But the problem is we just don't know for 100%. So what we can do, we should do, which is biosecurity. Therefore, the handlers, the human handlers, ought to be at least immunized. That would be one small, easy measure to introduce.
A final question here, Dr. Pankhania. As you say, there is a lot we don't know, and we are on a very steep learning curve. Apart from immunizing or making sure that we are careful about how we contain the spread of the virus in terms of animal handlers, what more could we be doing apart from culling potentially millions of animals simply because of a fear of COVID-19? Final question.
This is a very important question, because I bet you we will get more and more of such viruses emerging because we are cutting down forests and going more and more into animal territory. So what can we do? Well, one thing we can do, we must do, is less of the destruction of animal habitats and less of keeping animals that we don't normally keep together in, for example, trading markets or wet markets, etc., where transmission of viruses from bats to an intermediate animal to humans can occur. So that we know, and because we know, we must do a lot more effort to stop it.
Thanks so much for all that, Dr. Bharat Pankhania from the University of Exeter.